Hello, everyone. It is Mo in the Deep End here, and we with Frybert eating a treat because he is being relatively good for Fry. And hello, Paige. I know that there are a lot of other trials on, and I know this is in the pastime. So there is no shame in being in the rewatch crew today. Excuse me. And we have Salbert with us. Or maybe. But we are going to watch at least the plaintiff's part or Maya's part, Maya's attorney's part of Dr. Gupta's, um, who is I want to say a defense, but he's actually a plaintiff since this is a civil case. And well, I keep trying to add him, and I don't know if it's a me technical difficulty or a him technical difficulty, but Sal will be on when he is on. Maybe, uh, oh gosh. Oh, why can't I remember his name? I know his name, and for the love of Cheetos, why can't I remember his name? Doggone it. It's on the tip of my tongue, and if I could remember it. And he's here.
I changed my audio yesterday, so it was black
Oh,
through the TV.
oh, okay. I was like, "Oh, crap. Am I messing something
No,
up?"
no, I was
Which
panicking,
is
trying to like leave so it didn't blast through,
oh,
and I thought I
okay.
fixed it and didn't.
Oh, well, I'm glad I'm not the only one that panics like, "Oh god, oh god, oh god, oh
Yeah.
god."
So
'Cause
how are you doing?
generally
Yeah.
I am, so, when you get really busy and, you forget to eat,
Mm,
on time,
yeah.
that's where I am, where you're, like, busily shoving food in your mouth because you're like, "Oh, crap, I haven't eaten," and that's why I'm a little bit
Yeah.
flighty weird. But we are, going to be revisiting Dr. Gupta, and I've heard that he is really good at explaining things, as far as CRPS, and he was a really good witness, um, and kind of like hello, Paige, Friberto? No. Uh,
Yeah. What I saw, he was pretty good.
at least in explaining sort of the disease and a lot or the syndrome or whatever you wanna call it.
Yeah.
And kind of how it affects the body in kind of layman's terms. When I first got diagnosed, I believe that I watched a symposia with him in it,
Mm,
and I think I turned it off because he was using a lot of medical terms, but he seems to be highly regarded in this particular area of expertise, and I did want to watch it, but like someone said in Nicholas's stream, this is a little close to home. I
yeah.
haven't been, I've been keeping up with the trial in, Discord and stuff, but I
Yeah.
haven't been watching day to day because, uh, you know,
It's hard.
yeah, it's hard. And, I thought I could do it. I really did.
Yeah.
And just the testimony of watching the brother and everything, I think I had a
Yeah.
pretty rough day after that, so, picking, like, the doctors and different things with
Yeah.
you is something we can do, and I know we need to finish up Maya's testimony, sometime with,
Yeah.
Crime Spies, but I definitely wanted to do Dr. Gupta because I know that he was really knowledgeable, so without further blabbering from me, let's let him talk for a little bit. Now, does does lawyer or, discombobulated get better?
Um. No, not really. I don't think.
Oh, okay.
I mean, I think they're winning. The jury questions seem to be going against them, but it's just he's kind of all over the place.
Okay. Christine, good afternoon. I don't know. It's a personal style thing. Uh,
Yeah.
what is the doctor's first name? I'm sure he will tell us when he gets on the stand.
Yeah.
I do not know, but let's end the talk, and I will put a sound booth.
Basic clerk, and raise your right hand.
Please solemnly swear or affirm testimony about to give will be the truth, the whole truth, nothing but
Is it 1.25?
Oh, no.
I mean, up to you.
Well, if it's too fast, let me know, guys, and I will
Yeah.
put it back down, but this way we won't be here for forever. If you get the reference, you get the reference.
Yeah.
Hold on, I'll make sure I've got the exhibit. Correct.
You're welcome to have a seat if you wish.
No worries, Eris.
Please state your name.
No
for the-
worries.
Please state your name. for the
YouTube
record.
is
Pradeep, Pradeep, Chopra, Chopra.
Yeah.
And have you been asked to testify here as to the condition of Maya Kowalski when you examined her in 2017?
Yes.
So I'd like to give the jury the benefit of some of your background, training, and experience. The first thing I'd like to start with, if we
how
could,
is the sound,
is,
everyone? I've got a booster on.
tell the
I
jury
think
little
it's
bit
a
about that. First, what kind of
tableau.
doctor?
Okay, let me try the
I'm
other
supposed to
one
be a
then.
pain medicine doctor, but I take care of medically complex patients.
Is it turned up in the
Mostly
browser?
pain.
And where did you go to
Yeah.
school, starting with college?
My medical school was at the Harvard Medical School. I did my basic training over there, and I did my
Okay, it's
residency in
turned up on
anesthesia
both
and critical care,
things, so
and then I did my fellowship in pain medicine.
And was this all at Harvard?
This is all at Harvard. Yes,
How many years did you spend at Harvard Medical School and the Harvard Medical Center?
6 brutal years.
And do you often speak on the issues of CRPS and chronic pain?
I do.
Have you prepared different TED Talks or the same type on these issues, CRPS and chronic pain?
No, I haven't done a TED talk, but oftentimes different organizations, various organizations invite me to give a talk. It's mostly to patients, and sometimes hospitals will invite me to give a talk to their physicians on CRPS.
I know that you have won several. Well, first, tell us a little bit about your family. You're married
Yes, I am.
and you have how many children?
I have a child.
And I understand one of them has some challenges. It's predicate for his ability.
I have a son, and he's a special needs child.
And so, are you familiar with the challenges to parents for special needs children?
Yes, I'm very familiar with that.
I understand that you have won several awards over the course of your career for humanitarianism involved in medicine. Can you tell the jury about that?
Yes, there's a bunch of awards that I've won actually.
Okay.
But for the humanitarian award, it's called the Compassionate Care Award. This award is only given to one physician in a year out of the entire country, and it's a very rigorous selection process.
I'm pretty good.
Look at the patient.
okay, I
is the
adjusted both of
physician's
our
compassionate,
mics
Okay.
has empathy,
down, so
and many other things.
How long have you been in practice?
I started practice in 2000.
Okay. And are you board certified?
Yes, I am.
And what are you board certified in?
In anesthesia and critical care, and in pain medicine.
And do you have experience in pediatrics of any of these areas?
I do.
Tell the jury a little bit about your experience with pediatric pain management.
So of the 6 years that I spent in Harvard, about a year of that was spent at Boston Children's, where I practiced anesthesia, critical care, as well as pain medicine.
And so you had the opportunity at that time to see pediatric patients with pain, chronic pain issues.
Yes, I did.
And what do you do now? Are you teaching now?
I do. Well, I run the Center for Complex Conditions, which means I see mostly very medically complex cases, both adults and children, and I also teach at the Brown Medical School.
And Brown University is an Ivy League school.
It is an Ivy League school, yes.
And what do you teach there?
Same thing. I teach my students how to, uh, I tell them that you're going to learn medicine all your life, but you need to learn how to be able to examine a patient, how to be empathetic to a patient, how to listen to them, how to understand what they're trying to say, and that's my job. That's what I try to teach them.
So you're a professor at an Ivy League school. Can you tell the jury the importance of a physician gaining the trust of the patient in terms of care and treatment?
Well, gaining the trust of a patient is to be able to, number one, the most important thing is listen to the patient. Take the time to listen to what they're trying to say. And once you listen to them, then you can, ask them some questions, get to know them better, even get to know their families, and then
You would be amazed how many doctors don't do that anymore.
Yeah.
So the second time I went in, around, Martin Luther King Day, after Mr. Moe threatened to hog tie my ass and drag me in because I was continuing to just, like, push through pain and tell myself it wasn't the hospital so much, saying this is all in your head, you're making this up, the shooting pain, the freezing, all of this pain is just in your head, you're making it up and malingering. It was my own head saying it, you know. When my foot started turning purple, Mr. Mo was like, if you don't go into the damn doctor, I'm hog tying you. So I went into the doctor and they realized that that little bump bone, which I'd broken, hadn't actually fused together, hadn't healed. So they sent me to a surgeon first. And I didn't realize. So you have to have your mindset right with surgeons. Surgeons mostly work with people that are unconscious, and they tend to be, to not sound politically incorrect, semi-autistic. So don't expect, like, warm, fuzzy feelings. But I went in as a patient in pain, not understanding why my foot still hurt, and, you know, went in wearing a boot which hurt tremendously, like Maya, I'm sure, in those boots trying to get her foot to not do that, pronation thing. And he looked at it and he's like, "Yeah, this isn't my we need to send you to nerve guy. This isn't my deal." And I remember going into going back to my van, just in tears because I was like, so now I have another appointment 2 weeks from now, you know, with still no answers as to why everything is happening. And, once I changed my mindset that this man works with unconscious people and I shouldn't expect an emotional response, it, it made everything much easier to understand with him. But when I was in acute pain and just wanted answers because they had been treating me all wrong, which was partially my fault, granted, because I let it go for so long, just trying to tough it out. It was still, you're on that edge. You've just tried to tough it out for weeks and weeks and months, and you just want, relief. And all he can give you is, well, that's not my problem, which I get. Now looking back, I get that, he couldn't do anything, but it was just for the love of all that was holy. It was, you know, one more doctor, and I'm so lucky that I got diagnosed within, under a year, where people have waited years and years. And welcome, it's me, Josie, and uh Eris, did I say hi to you? I don't remember. I am sorry. But, he makes a very good point that doctors need to take time, and unfortunately, uh, insurance wants them to triple book people,
Hmm.
it seems. So, let's continue.
then do a full physical examination, not just a partial examination, and then sit down with them and come up with real expectations. What are the real expectations? What to really expect, and what your plan is to help them.
Now, tell the jury a little bit about how you got involved in the examination and rendering opinions about Maya Kowalski.
I was back in whenever she came, I can't remember the year,
2017.
2017. I received a call from the court, and I can't remember whether it was the judge himself or somebody else from the court. And I was told that they needed me to examine a patient and give an opinion on that.
And do you know how or who recommended you to perform this examination?
I honestly don't know who recommended that because I wasn't really paying attention on that.
Okay. It could have been Diana Kowalski. It could have been one of the physicians involved. Could have been any of the parties involved.
No, it wasn't anybody from the Kowalski family. It was not a physician. I know it was somebody had to do with the legal system. It might have been her attorney at that time, or it could be somebody from the court.
I see. And so what steps did you take then? And ultimately, did you prepare a report, which the record reflects is in evidence? 2005-001 through 2005-021. May I approach to have the doctor identified?
Okay.
And is this the report you ultimately?
Yes.
Now,
This is the report.
you can, we'll get it back in a moment. Now, so you weren't a formal, what's known as a CME or IME, but you understood that you were supposed to render a fully independent opinion?
Yes. So this call that I got from the court in Florida I was tasked with one job, and the job was to give my opinion about what was going on with Maya, and that was it. I was not going to be the treating physician. I was not going to take over the care, just to give an opinion. End of it.
Got it. I forgot, you have some additional degrees. What is a MBBS?
MBBS is, so before you come to the US, you have to be a physician back in India. So I'm from India.
Right.
And you get a degree, it's called MBBS. It's a British degree.
Right.
And then you do your MD and all that again. So I went to med school twice.
Okay.
Oh,
And what's
wow.
a DA? Is that similar?
A DA is a kind of it's a diploma in anesthesia. It's like a mini training in anesthesia for a year.
And then MD and then MHCM. What is that?
That was from the Harvard School of Public Health. That was on Masters in Healthcare Management.
All right. And so have you worked in both hospitals and in private, seeing patients clinically?
Yes, I have worked in quite a lot of hospitals. Now I don't work in a hospital. Now I work in my own office.
Okay. Now, tell me what you first did. Tell the jury, rather, what you first did in your job as you saw it to survey this course of treatment, and then subsequently, I suppose, examine Maya. Tell them how you went about it.
Right. So, they sent me a boatload of documents. Scary. That was scary. That was like 5,000 pages. And
Good.
but
I
don't
like
review
this
documents
guy.
before the
Yeah.
case comes in. I need to make my own opinion first.
Why is that important?
It's important because I don't want my my thinking to be biased by reading other people's reports.
Is there a problem in medicine with a diagnosis taking on a life of its own, otherwise known as a narrative?
Yes, it's a major problem. What happens is that one physician, maybe depending on his incompetency, makes a diagnosis without any basis, and then that gets popular.
Shots fired. I like this guy. I mean, I'm not saying he's saying you're incompetent, hospital, but I'm going to go ahead and read it as that because, wait, I forgot. I will put, well, this isn't quite the shirt to put it on, but I have my petty patch on now. You probably can't see it, but it is firmly on and placed.
populated into the medical records.
Friberto,
And then it's just, after that, it's just
you
passed
are not
on
being a good boy.
forever because no one wants to change that.
And so it takes quite a bit of gumption, for lack of a better term,
Hey,
to step in
you're
and
okay.
change the narrative.
Sustain.
What, if any, effort does it take to change the narrative?
Bring me
It's-
back some too.
It's almost impossible.
Once
I've
it's-
had a few patients who have tried to do that, and it's extremely difficult.
What does that mean? A doctor should just blindly follow a narrative, or should they give it an independent
Okay, you can
view,
have one treat.
excluding a narrative?
One.
So if it's a major diagnosis and it affects, so if I'm seeing a patient and say, let's say that I'm seeing a patient for pain in their left knee and they also have asthma, I'm not going to worry too much about the asthma part. I might say, hey, do you have asthma? And they'll say, yes, I do. But I'm not going to go into great depths with it. My focus would be more on the knee part then.
And so you saw Maya first before you reviewed all those records.
Yes, I tend to, the way I work is I don't like to be biased. So I see the patient first, make my opinion, and then I go back and look at the medical records in detail and then figure out where we are with it.
So I want to deviate a little bit from going through your findings, and I first want you to help us understand CRPS as you know it. Have you treated CRPS patients?
Oh, yes, I have a lot.
Can you give the jury an idea of how many per year?
I actually did that calculation for this. Yes. So approximately 5 patients a week for 20 years. And the math came out to be about 125,000 patients in the last 20 years with CRPS.
My goodness. And have you yourself participated in any studies or surveys?
No, I haven't. You mean done research on it?
Yeah, or cooperated in providing patients for clinical evaluation, things like that.
No, I don't want to. I don't like to send my patients for clinical. They're already in so much pain and they're already suffering, and I don't do that.
Understood. So tell us now the signs and symptoms
Good
of CRPS
doctor.
that they can understand as we go through this and show photos that they should look for here.
CRPS is one of the few pain conditions that you can literally see. I mean, if I say I have a headache, you can't see the headache. If I say I have knee pain, you can't see that. But CRPS is one of the conditions you can actually see. And the diagnosis of CRPS is based on very clear rules and regulations. There's a whole checkbox, and you have to check certain boxes. And when you check a certain number of boxes, then you come to the conclusion that the patient has CRPS. So, for example,
Yeah, no, please. I'm asking you to go through. It was okay.
Right. For example, obviously the first one is that the patient has severe excruciating pain and there is no other explanation to it. Nothing else explains it. That's the number one. Number two, the rest are kind of optional and you have to pick and choose which ones you see. So one of them is there a temperature difference? So if I have CRPS in the left leg, and so the temperature in my left leg might be hotter or colder as compared to the right leg. The next thing is you look at color change. Oftentimes,
Okay. So my leg is my left leg is actually pretty weird. So my foot up to about the ankle will turn fully purple and feel very cold. The rest of my leg feels very hot to the touch. So the temperature change thing is very real. The reason I prefer Birkenstocks is that on bad days, my foot can swell up to a size different.
Mm.
So Birkenstocks have adjustable size, and it's about the only look. The first time I am a cheapskate. Look, unless it's Sailor Moon or something ridiculous, like a giant, you know, wiener-shaped, dog toy that I wanted to get. Like, if it's ridiculous, I will spend money on it, but if it's for me, I'm like, $100 for a pair of sandals. I had to call Mr. Mo, and he had to talk me down. He's like, "Why are you calling me to buy sandals?" And Sal's like, "I don't wanna get married. This sounds like a lot of drama." I will say this is only me drama, so you might marry someone completely sane-ish.
Nah,
Eh,
I doubt it.
but well, I'm just letting you know that if you marry someone with a lot of guilt and shame issues, that she will call you when, she's spending $100 on a pair of sandals for herself. So, um, but definitely temperature changes, and before I was diagnosed, I would have Mr. Mo touch my leg because it would be 80 degrees and, I would feel like freezer burn on my foot and then
Oh,
sunburn on my leg, and it's a mind screw because your
yeah.
mind is basically playing tricks on you. So, what he's when I finally got diagnosed, everything fell into place, but before that, it was kind of, what is going on here? And I had several different, well, it could be this or it could be that or, these things, and it is hard, not knowing, and then when you know and it's chronic, it's a whole other different kinda hard. But you find workarounds, and it's not okay, but you find workarounds.
Sometimes the affected side is either dark red in color, even blue in color, as compared to the right side. You look for swelling. In the initial phases, swelling is pretty obvious. Later on, you don't see it as much. So you look for swelling in these patients. You look for skin changes. The skin may sometimes become thin and shiny, or they may develop small, tiny lesions, almost like blisters that are painful. They can develop that. They even develop hair changes. Some patients actually grow more hair, and some patients have less hair. It can be in the same side or on the opposite side. You can see nail changes. Their nails start to kind of break off. They get brittle nails. Um,
And what about asymmetry in muscle groups from right to left? Is that an
Right.
indication?
I was getting to that. So
Sorry.
the last one is muscle symptoms. So do they have what's called dystonia? Dystonia is a terrible condition. So I'm going to show you. Like, if I had dystonia in my left hand, it would be like a tight muscle, like the arm is taking a life of its own and it's cramping up. Or they may have tremor. So they may not have tremor when you don't do anything, but if you say touch them and then they start to have a tremor, they may have
Okay,
muscle.
so I don't know if you all saw me when I was with, Sal and Crime Spy, and, Maya and her mother were sitting there, and, someone was touching her leg, and it started spasming, and I said, "Would you stop effing touching her leg?" Because that happens to me, but there you go. That does happen to me. So, yes, I have um, I think I showed it, but let me see if I have it still. Videos. No, I think I actually, dropped it, but I can do. I am a genius sometimes. Let me continue playing
Muscle
while I
weakness, they have
pull it
muscle
up.
atrophy, the muscle starts to shrink. So there are many muscle symptoms that these patients can have.
I want to, if you could, and I think I wanted you to explain what really happens in CRPS, the central. I want you to explain what we know so far about CRPS,
Hey,
how
one
it
second.
starts. Yes.
I just have one other clarification on
Go ahead,
CRPS.
please.
When I say that these patients have pain, we're talking about the world's worst pain. I mean, this pain is worse than amputation pain. This pain is worse than childbirth pain. The gentlemen on the jury won't understand that, I'm sure.
Okay, so let me see if I can. Okay, so in that clip, I am holding my breath because I'm trying not to scream on the thing.
It's that bad.
It is. Yeah, when I say that Mr. Okay, when I say that my husband has to shut windows because a breeze hurts, when
Jeez.
my skirt hurts, when a blanket hurts, it hurts. Um, it it is the worst. It's called the suicide disease.
Mm.
So it's not. I I think Maya and people, it's not constant for most people. I think if
Yeah.
it was constant, I think that would be the hard part. And I think you get used to your baseline. Like my baseline is a 5. So um, think of like a mild toothache. I walk around with that and I've kind of gotten used to it. So on a good day, mild toothache is okay. The problem with it is learning for me when it hits is if I get to a 7, then I'm in a flare. And I don't quite know. There are some days I know I have a trigger, like if it's rainy and cold, I know it's going to be a bad day, so I will plan accordingly. But then there are other days I have no idea and it just hits you. And those are kind of wonky days. So it's something that you learn to live with, but it is hard because the people around you kinda get used to it, but when you meet new people and they don't understand that, "Hey, if it's raining and cold that day, you're gonna be out, and you might break plans," or you have to explain, "Hey, I have a limp, I can't do this, that, and the other." It just gets hard to constantly explain it, so you just at least for me, I kind of fell into myself a little bit because I didn't wanna have to explain everything. Because it feels like you have to have a long, like, list of, "Hi, my name is Mo, and I have CRPS." And, and I don't want people to see the CRPS before they see me, so I
Yeah.
tend not to say anything, but then when you have a day like the Labor Day and I had the dystonia, I had the shaking, and my whole left side kinda curls in on itself when it's really bad, and I have to have my husband help me walk.
Right.
It's not as bad as I thought it was going to be. It really isn't.
Mm.
I made it much bigger in my head, so it wasn't Godzilla big, but it is humbling,
Yeah.
but it's not terrible. So, but he's right. It is. I don't know how Maya has handled it with such grace. I have handled it spectacularly bad for the most part for several months and most of half a year, and I'm sort of kind of handling it okay now. So I can't imagine how she's handled it with such grace, and I'm sure she has her bad days, but she is my hero. She has done so awesome, and every time I have a bad day, I look at her and how she's going every day to this trial, and I think, "Okay, I can do it." So, that's my spiel. Hello, MLS.
This pain is so bad, so bad. The worst part about this pain is that, if I stub my toe, it looks like the world is going to come to an end. Okay. But I know that this is going to go away in a few minutes. But CRPS pain does not go away. It's there 24 hours, 7 days of the week. And it just stays on and on and on. And the worst part is that there's no known treatment to this. We try all sorts of things. Some work, some don't work. But this is such a, this is often known as a suicide condition because these patients, the pain is so bad, they can't sleep, they can't eat, they can't work. Their families don't believe them because you don't think like somebody. The general impression is, oh, you have pain, take a Tylenol and it'll get better. This is not Tylenol pain. This is your hand in a hot stove. That's exactly what they described as. In fact, patients describe it as that, as if their hand is inside a hot fire stove, and and they can't take it out. That's the thing. So I just want to clarify that this is, when I say pain, it's not a small itty bitty pain in the joints.
And what is the McGill pain scale?
The McGill University in Canada decided to see, like, okay, where do pain conditions stand? So they interviewed a bunch of people, and they said, all right, where in this scale would you put your pain? Like pain from labor or pain from amputation of a digit. And so they drew a scale, and that scale, CRPS was CRPS was way above anybody else. It was way above amputation pain, cancer pain, or even labor pain.
With your permission, Your Honor, I'd like to publish a photo of the McGill pain scale. The jury can see. Ta-da!
So
Miracles of technology.
what I'm seeing is what the jury's seeing.
Yeah, the jury sees that.
Okay, so if you go from the bottom, you can see, tension, headache, sprain, and so on. As you go up, then you see non-terminal cancer, chronic back pain, and as you keep going up, prepared childbirth is number 32, and then you keep going up, and then you come to amputation of a digit is 39, and then so forth, and then finally CRPS, often it was originally known as RSD, is rated as 46. So on a scale of 50, 0 to 50, CRPS is 46. Nothing is higher than that. It's such a terrible pain.
Now with this, can you tell us from your experience whether any of your patients have had, not parents, patients, but any of your patients have had difficulties going through a number of doctors before they're diagnosed?
Yes. So unfortunately, most doctors don't know about CRPS. They may have read about it and they must have blown it off as being an extremely rare condition. I don't need to bother with it. I'll probably never see it. But unfortunately, it is a very common condition. And they miss the diagnosis. They think it's an arthritic pain, or they think it's some sort of a muscle pain, and they get prescribed some of these itty-bitty pain medicines. And it was not an official study, but it was a very unofficial kind of an anecdotal article in a journal. And they said the average.
Hold on,
What's the legal basis? Sustained.
well, just tell us without going into the details of any study, just tell us what the latest finding is.
Same objection.
What do you understand the latest, the standard, the knowledge of CRPS is, as you're about to relate?
You mean how many patients develop CRPS?
Well, that'd be interesting.
Okay, so essentially patients go through a lot of physicians before somebody will say, you know what, I think this is CRPS. You should go and see the pain physician, and they might be able to better diagnose it.
Have you seen, or is it, the better question is it prevalent or not prevalent that when doctors cannot figure out this disease, they assign a somatic basis or a psychological basis?
Okay, so this is an interesting phenomenon. There is a difference between young women, especially, versus adults. Usually, young women, and CRPS is, by the way, very much more common in women than in men. When they present with it, it is often stamped as being psychological or anxiety or making it up or some sort of a psychiatric diagnosis. Like you really don't have pain, you're just seeking attention. In adults, it's a whole different situation. In adults, it is taken much more seriously.
I hate everyone. Young girls, you are seeking attention. Adult women, you're definitely in pain. What is wrong with people?
Yeah.
I mean, all this talk about mental health stuff, and then they just want to throw people under the bus.
Yeah.
To be fair, I had to talk about Delphi today, and I might be in a mood. It might be boozy news tonight, not newsy news. It may depend.
They're offered different treatments and different specialists who can then look at it more carefully. And that's big.
Go ahead.
That's the big difference between younger patients and adults.
And so what is the effect on these children, younger patients, for having their pain denied by physicians repeatedly?
Well, put yourself in their shoes. Let's say you're a 12-year-old girl who develops this CRPS in her left leg from doing, acrobatics or something, or rollerblading or something. And then now you have this severe pain. And
Oh.
obviously the first thing your parents are going to do
Sorry,
is
wrong
pin on it,
button.
give you some Motrin, Aleve and all that. Doesn't go away. And now it's becoming excruciating, and it's becoming red, hot, swollen, and you can't even wear clothes. So then your parents take you to the doctor, and then the doctor again has no clue what's going on, not sure what's going on. Eventually go from doctor to doctor because they go to an orthopedic, the orthopedic sends them to a neurosurgeon, the neurosurgeon sends them to a physiatrist, and it continues the cycle. And eventually they'll get to one person, and that one person will say, I know this condition, it's CRPS. And then they go on to, getting the treatment that they need.
So now what I'd like to go through now, if we could, and for this, I don't think council has an objection to the actual the pictures. That was not part of your objection. Glial cell picture. All right. So on let's go to 12 if we can. Now, coming up here is something I think you provided for us to. It's an incredibly sophisticated artistry, but
That it should be in the Smithsonian. I can tell you that. Have you seen it?
yeah, just a second. He's got it. I tend to jump around a lot, and so.
Right. I apologize, but that's my drawing. Okay. But that's how I think. Okay. When you're only one brain
He has a
cell,
whiteboard
that's
of
how you
truth
think.
too.
So this. So
Favorite
I just want
doctor
to, before
ever.
we get into this picture, I just want to explain to you what happens in CRPS. Like, okay, we got this pain, but what is going on? So the brain is not a bunch of nerves. So if you cut open, well, my brain, you'll see only one, but if you open Attorney Whitney's brain, you'll see a ton of nerves in there. But that's not what. It's only 20% of your brain is made up of nerve fibers. The electrical wires in your brain are only 20%. The rest of it is packing material. And that packing material is known as glia, which means glue. So in the old days, the thinking was that, there are these nerve wires in the brain, and to support it, you would put some packing material in there. And that was the idea, that there's glial cells and they have no other function. But now we know that they have a lot more function. And besides CRPS, they're also implicated in Alzheimer's disease and dementia and other conditions. But in any case,
Let's show the next one.
well,
The 13 here. Another beautiful sketch you've done for us.
so what happens is, this one I need to explain. If I take a pen and I stick it in my finger, a signal goes up into my brain, up my arm, into my spinal cord, into my brain. And my brain then reads it as pain. And I yell out, pull the pin out, I rub it, it feels better. Everybody goes back to their business. But if I take a pen and I keep sticking it into my finger again and again and again and again for 24 hours a day, then there's a barrage of pain signals that are going to my brain, and there's a barrage of pain signals coming down. This traffic of pain signals activates the glial cells. These glial cells get upset, they get angry. And when they get angry, we can,
Yeah, let's have
Go to the next
14.
slide. when they get angry, they release chemicals. These are called chemical inflammatory mediators, which means that they produce chemicals that cause the nerves, because remember these glial cells are around the nerves. These glial cells then when they get angry or when they get inflamed, they then release chemicals that cause the nerves to get inflamed.
Let's go with 15. Okay.
So now the nerve is inflamed. And this is the basic mechanism by which a lot of chronic pain can be explained, but this is the basic mechanism behind which CRPS is explained. So what I'm trying to say is that CRPS pain, so if I have CRPS in my left leg, it doesn't live in my left leg, it lives in my brain. So you could essentially cut my left leg off, I would still feel the pain because the glial cells in my brain are still activated. If eventually,
Well,
if you
damn
follow
it.
my
There
lead,
goes my
eventually the glial
exit
cells are
plan.
going to say, "Oh, we're getting no more
Yeah.
signals," and then they calm down. But that's a different story.
You,
So
you
the
know, this is the first time I've had a really good, simple explanation of what's going on.
Mm,
I mean, he's explained it in a way kind of like I explain it,
yeah.
but he's explained it in such a wonderful way. And I'm sitting here slowly choosing my words because I've just taken off my boot. I no joke, you guys, I've had to continue training myself to be able to wear a boot and socks.
Mm.
I know that sounds silly. I really
No.
but it is not comfortable to wear socks. On my I'm actually buying leg warmers uh because I love the 80s. But it's not comfortable, so I'm taking them off and it is not a comfy feeling. So, but this is actually uh the first time that I've had a good, simple, down to earth explanation from a medical person, and gosh, I wish he was my doctor. Because my doctor is more akin to a surgeon in the, not able to read social cues whatsoever.
Yeah.
So
the
he's
treatment
definitely very personable and
these
very
glial cells to calm down is all treatments that we do are to make these glial cells calm down so that they're not as angry.
Do we know why the glial cells get angry yet?
We're not 100% sure why they get inflamed, but one of the theories is pain that comes on from CRPS. The repetitive pain signals going to the brain cause these glial cells to get inflamed.
And can this process, the CRPS, glial cell aggravation, start in some patients from an emotional event?
So once these glial cells are inflamed and you're in the process of treating them and they're starting to calm down, like not all of them calm down at the same time. Some calm down and some don't, and say 20% will calm down first. But if there's a triggering event, like let's say emotional stress or physical stress, then these glial cells go back to getting inflamed again.
And so does that happen every time, or is that again kind of a hit or miss on whether it's going to happen?
That's a difficult question to answer because there's a lot we don't know why this is happening. So it's yeah, I mean, depending on the stress, okay, I have an exam coming up, the glial cells are probably not going to get activated. But if somebody came and punched me in the nose, then yeah, I guess the glial cells would get activated.
And through the course of this, and we'll get back to the examination in a moment, but through the course of this, have you had the opportunity to review the Johns Hopkins records pertinent to this case?
Yes.
And can you explain to the jury in terms of this, some of the cells being activated, some of the cells being not, the problem with interrupting a treatment process?
So I have to go, in order for me to explain that, I have to go a bit outside the Johns Hopkins treatment paradigm.
Go ahead.
So in this case, she was getting her treatments. Okay. She was seeing doctors, the doctors were giving her drugs, and she was starting to, there's a whole algorithm. It's not just simply giving ketamine or some one drug and magically everything disappears. So she was slowly starting to get better and much more active. And then what happened was at the Johns Hopkins, all of this was suddenly stopped. And when it stopped midway. It stopped at a point where she was improving, everything was stopped, and the glial activation came back, her pain came back, and plus the stress, the emotional and the physical stress. Remember, one of the things I told you about CRPS was that this is pain to touch. So it's not as simple. Even the slightest touch causes pain. But the problem is that if I have CRPS in this hand, and if I touch it lightly, the whole hand hurts. And it continues to hurt for weeks. And what was happening at the hospital was everybody walking by would touch her. I'm not sure why, to test her, to examine her, for whatever reason. Various people would touch her again and again.
because they're
And each
dicks.
time they did that, it was
I
triggering
mean,
the pain again. Remember
allegedly.
the barrage of pain signals going up to the brain that would cause the glial cells to get inflamed? That would keep repeating again and again.
Is that one of the reasons why well, let me ask you, do you have an opinion based upon your background, training, and experience, and from your examination of Maya and your review of the records in this case, as to whether the treatment she received at Johns Hopkins All Children's Hospital from in October, November, December of 2016, and then into January of 2017, whether that permanently aggravated Maya's CRPS?
Is that the time when she was sequestered in the hospital?
Correct.
Yes, that did.
And and that what you just explained, is that the reason why the glial cells had not fully gone back to normal at the time it was
Right.
invoked?
So
Objection, Your Honor. I would like to
Approach, please.
He's ruining our case. I mean, I'm sure that's what he would say. Hello, blue-haired Bible lady. He really does. I mean, like I said, I've had this for a year. I've seen many doctors. Um, I have a whole bucket full of medicine, having gone from 0 medication to having an entire tote full of medications that they've tried. Um, and this is the first time that I've had an easy, understandable medical person explain to me what I have. Oddly enough, it's on a trial. But, it's oddly comforting, which is odd. But what are you gonna do? And Godspeed to those 4 hairs that are no nonsense and taking no crap from the defense.
Dr. Seuss character.
Well,
Or you mean
those
the
4
judge or?
stand-up the judge, the 4 stand-up hairs right here that are just
Yeah.
like
Love his
defense
comb
for
over.
you. Yeah, I don't get why he just doesn't let it go, but, we are all vain about different things, like, I have a thing about my arms that I'm sure no one cares about, but I do, so, it
The
it
Rogaine
is
gonna
what it
start
is.
working any day.
We all have our things, so I cannot blame the man at any point. It is not like I myself do not have weird things that I am also incredibly vain.
Yeah.
No, this judge is the guy from Airplane. The one that's sweating all the time.
Oh yeah.
I do love that, the guy from the Airplane pilot was like, "No, guys, it's okay. I was on shrooms." It's like, it's a novel defense.
Yeah.
And I'm willing to allow it. So I think I'm gonna go another 30 minutes, and then I do have to figure out something to feed the horde.
Okay.
So that's why it's part 1.
Gonna
I
overrule that
know
objection.
it's not a super long
Mr. Anderson,
stream, but I do have
I
to
think
feed
we asked the
people
question for the doctor.
No worries.
because they continue to wanna
You didn't
eat for
remember every
some
single word of
reason.
that? All right. Do you have an opinion based upon your background, training, and experience, and to a reasonable medical probability, based on your review of the records, which we'll get into in a moment, and your examination of Maya Kowalski, as to whether the interruption of her treatment process at Johns Hopkins aggravated this process and thus her CRPS?
Yes, without a question.
And can you tell the jury whether, I need to lay a predicate, are you aware of the psychological symptoms that Maya Kowalski suffered from at Johns Hopkins All Children's Hospital?
I mean, I don't remember them off the top of my head, but I do remember reading about them.
Okay.
But it's not surprising if a 10-year-old girl with severe excruciating body-wide pain is segregated from her parents, would develop psychological issues.
And again, can an emotional situation like that trigger aggravation of CRPS in the future?
object to the same objection, Your Honor. And I'm happy to approach again if you
I'm
want.
going to overrule the question.
Just to protect the record regarding future carrier review.
I understand. I'm overruling the objection.
So yes, like I said, the
Thank
brain
you,
is
blue
a
hair,
very intricate
Bible lady.
structure, and it's not simply saying that okay, it's dealing with pain, structural pain from the leg. It's more than that. It's connected to many other emotional things. Pain and emotion go much together, hand in hand. And so if your emotion, you're in this world's worst excruciating pain, and imagine you're a 10-year, you have a child that's 10 years old, has this world's excruciating pain, is now separated from you, put into a hospital that you cannot go and see, or even your family cannot see. The child is going to go through a lot of emotional stress, and that itself would trigger her pain. Well, for one, it was interrupted. For second, the emotional stress of having not exactly very friendly people come in every time, um, and people who weren't listening to her, people who were not paying attention to her pain, people who were not treating her pain, was stressing her out, and that was causing a lot of her pain to flare up.
The answer stands.
Let's get back to your examination now. And
Okay.
I believe with the court's permission, you may refer to the document and evidence you report.
Oh, he is just throwing
Explain
them
to the
right
jury
under
the
the
result
bus
of
and
your physical
then backing
examination.
them up
And first, was this
figuratively,
down here, or was this up
figuratively,
at
YouTube,
Brown University or the
figuratively.
Pain Center?
This
Rhode
was
Island.
This was in Rhode Island.
Okay. All right.
Yes,
All right. And
the smallest state with the longest name. It's Rhode
I
Island
love
and
this guy.
Providence plantations.
This
So-
guy for
all right.
president.
So who arrived there at your offices?
This was back in January of 2017, and Jack, her father, was there, and I believe her little brother was there.
Mhm.
He was there too, and yeah, and that's it.
Okay. Because Beata had already.
We had already passed.
And so tell the jury the result of your examination. What did you do and what did you find?
All right, so the whole exam took 5 hours and 22 minutes. Get ready for that 5 hours and 22 minutes of court time. I'm going to shorten that down. First thing I did was I took a history. I asked
Oh
her
my
what was
goodness,
going
yes,
on
he does look
and,
exactly like
what
this
was the problem
person.
and all that stuff.
If you guys look
And,
him up,
and then I started
he
to
look
examine.
the judge looks
And
exactly
that's
like
standard for any medicine. First, take a
American
history and
actor Steven
what treatments have
Stucker,
been
which means
tried,
I
what
will be
worked,
putting
what
him
didn't
in my
work,
next
and
thumbnail.
all that stuff. Then I did an exam directed.
You're
towards
welcome,
her,
and thank you,
painful areas.
Dennis, for
Oh,
that.
yeah.
And she described kind of a diffuse body-wide pain.
And I'm sorry, your
And she reported
judgeship.
pain to soft touch. And that's
It's
the
not as
classical
bad as
symptom
making him
of
a
CRPS.
Star Wars character like the last judge. So you're welcome, your judgeship. So let me backanate it just a little bit since I was talking over him, and I actually want to hear what he said.
Treatments have been tried, what worked, what didn't work, and all that stuff. Then I did an exam directed towards her painful areas. And she described kind of a diffuse body-wide pain. And she reported pain to soft touch. And that's a classical symptom of CRPS. Soft touch meaning it's just the softest of touch causes a severe excruciating pain. Both her feet were internally rotated. So both the feet were turned in like that. And it was a constant pain that never goes down to 0 or 10. Okay, I'm going to continue. So
Please do. I'm just trying to find a next exhibit.
okay, so it's a constant pain. It never goes down to 0. That's another feature of CRPS we always ask is, does this pain ever go down to 0? And they'll always tell you no. In fact, their pain is always 10 out of 10. On a good day, on a very good, rare day, it will be 9 or 10. That's how severe this pain is. And then I asked her if it spontaneously shoots up. You're just watching TV, you're doing nothing, and it shoots up. And she said, yes, it does. The pain increases with any physical therapy. Whenever someone touches her leg, that is. She did notice. I'm sorry, I'm reading her history. You want my exam?
I wanted to show the jury photo 2529-061 in evidence. It's a photo of Maya Kowalski. I'll just show you. Dated November 19th, 2015. May we show it? Display it.
Is it in evidence?
It is in evidence.
Yes.
All right, now, I'll represent to you, the record shows that at that date, Amaya was undergoing her procedure in Mexico, and that she was under general anesthetic. Why is that important in light of the allegations made by Johns Hopkins that she was faking her feet
Objection,
being
Your
turned?
Honor. The move to strike.
What, if anything, is significant about her feet being turned in while she's under general anesthetic?
So your feet get turned in because the muscles that control your feet are in a spasm. That's what happens. And you know, if someone is quote unquote faking it, then they wouldn't be doing it if they were under general anesthesia, because now they're not awake, they're asleep, and her muscles were still contracting.
So she had no control over it and they were still contracted?
That's correct.
And that tells you what about it in terms of it being voluntary or involuntary?
It's completely involuntary.
Okay, please continue on with your examination.
Okay, so I apologize. My first part was not the exam. The exam part was so she had diffuse pain to touch to both legs, and as well as the upper extremities. On the legs, the pain to touch extended from the front of the thigh to the side of the thigh and to the back of the thigh. So basically all around the thigh, extending over the knees. So even her knees had pain to touch. And then it went down to her lower legs, below the knees, up to the top of the feet. Then she had pain to touch to the front of the left shoulder, above the collarbone and below the collarbone, side of the shoulder, going down the arm, into the forearm, up to the hands, but she didn't have it in the hands.
Is that
So then-
significant?
She didn't have pain to touch in her hands, but up to the wrist she had it. Then I checked her temperature. So I used one of those laser thingies, and I checked her temperature. The temperature to the left thigh, the left front of the thigh,
Laser
was
thingies.
87 degrees, and the right was 89 degrees. So there was a difference of 2 degrees.
Is that important? That's significant, that amount of temperature change?
Yes, according to the criteria, which is known as the Budapest criteria, a 1
I was
degree
about to say
difference
that's
is
part of the
considered
Budapest criteria.
Then I measured the temperature of the upper leg below of the left leg below the knee, and that was 82 degrees, and on the right it was 83 degrees, a difference of 1 degree. The temperature to the left arm, so this is called the arm. It was, sorry, I didn't mean to. What I meant was that in medical terminology, this part is called arm, this is called forearm. In lay terms, of course, we call that the whole arm. But the upper arm was 92 degrees, and on the right side it was 99 degrees. There's a whole 7 degrees difference. Left forearm was 92 degrees. Right forearm was also 99 degrees. And this was all done without touching her, because when you touch them, then they have pain, and then
I might get one of them laser thingies and see if my leg is all different, but I'd have to get it for a reason. And Mr. Mo would probably say just to test if my leg is a different temperature is not a reason to buy a high priced temperature thingy.
and then it's sort of you don't get the right readings. So to be sure that she was, if someone is faking it, let's put it like that. Let's just say someone is pretending or faking it, and they say like, I have weakness in my leg. What we do is we measure the circumference of that leg or the arm and see if the muscle has atrophied or the muscle has shrunk. So I took a tape and I measured her left thigh, and it was 11 inches. And the right thigh was 12 inches. So there's a whole 1 inch difference between her left thigh and her right thigh. I measured the left lower leg, and it was 8 inches, whereas the right lower leg was 9 inches. So a 1 inch difference. The color change between the two sides was not very obvious. It was mild. It wasn't like glaring. And that color change happens when they're in an acute flare-up. So if I had touched her and I had aggravated her pain, the color change becomes more obvious, which I have not done, obviously.
Let me show you a photo. See if I've got it here of Maya. Yes, here it is. The knee. And do we have the one? Can you find the ones with the hand? Her hand was up. Okay, fine. This is in evidence as trial exhibit 2604-021, and the date of this is January 6th, 2017. Still at Johns Hopkins. May I approach, John?
You may.
Or actually, can we just put this up? I keep forgetting I'm old school. Okay, what's significant about the knees here?
So you can see how her knees are different colored. In fact, the left knee is a little darker than the right, but they're pretty much the same. And this is a kind of a significant change. But if you aggravate the pain, this change becomes far more significant, far more prominent.
Talk to us about lesions.
Well, let me just finish my exam and then I can go on to the lesions.
I apologize, doctor. Sorry.
And both her feet, as you all saw, both her feet were internally rotated. Now I wanted to see.
Oh, I found it. Sorry. It's 2604-014. Sorry, doctor. I keep interrupting. I know.
There's
Directly
gonna
to
be
the hands here.
$1 charge for every time you interrupt me. So the legs were trying to make some money, right? So her legs were internally rotated, okay? And I looked at why they were internally rotated. I tried to straighten them out. They straightened them out, and then they rotated back in, and I could feel the muscles were in a tight spasm.
This is another photograph from this day, which we will discuss later, of Maya being photographed. What, if any, significance is there to the hand?
You can see that how her hands turned dark red in color. It would have been nice if he had both hands, but you can see
I'm looking for it. I'll do my best. And I'll represent to you it was on both
Okay.
once I can find it.
You're muted.
So, with CRPS, you can also flush red fairly easily. My hands turn beet red. You know, with fair skin, of course, the one thing that I need is to turn red. And I'm going to go ahead and tell you guys, there will probably not be a Newsy News tonight. I think we have a storm coming through, and as much as I want to do Newsy News, I think I'm going to save my stories for tomorrow and just lay down. Unfortunately, my leg is having some issues.
Of course.
I do have leggings on the way, so I will probably not wear socks again. I think that was maybe a little too ambitious, which is, a learning experience. I'm trying to frame things in learning experiences, but I am sorry for that. I am going to stop this here. I'm going to try to make a quick dinner for the kids. They're going to be so excited they get to use the air fryer to make chicken nuggets. The joys of when mom is not feeling the greatest. Also, I will not be having Newsy News tomorrow. The boys have a musical jamboree or something or other at their new school. So, okay, get the chocolate away from the dog? Why are you guys get the chocolate? For the love of all that is Cheetos. Oh, now Griffin has a backache and arthritis, is what he just told me. For the love of all that, having smart children is awesome until they use their powers for good. But Sal, would you like to promote anything?
Yeah, just subscribe to Dolly Talk. Trying to get to 500, so about 170 away. And I'm
Yes,
going to be
please
on.
go.
Oh yeah. No, sorry. I'm going to be on. I think Excited Utterances Halloween stream tomorrow. So check that out.
I believe I am going to be on that one too. I am going to try. I have my costume ready, I believe.
Yeah.
With how things sneak up on you. I
Yeah.
was pretty sure like Halloween was next year.
Yeah.
Kind of how. But I have a costume ready. And yes, go subscribe to Sal. He has been my hype man, my twin. I'm pretty sure we are part of an experiment from the government. We are the same person in different body form.
Duplicated.
Which is odd because when we first met, we definitely thought we didn't have anything in common
Yeah, I know.
until we were like Bender and Bender.
Yeah.
Bender and Flexo.
I was like,
How
oh,
did
who's
this
this
happen?
weirdo with 6 kids? And
I know, and has to cosplay as a Pentecostal. It's really
yeah,
weird. So, and it don't subscribe to Excited Utterance. If you want to delve into any sort of graphic stuff and you are a little bit intimidated or a lot intimidated by computers, she is amazing. She helped me with this amazing overlay. I have been streaming for, I think, 6 months, and I have been scared to death and intimidated on how to make an overlay, and she walked me through it. I was able to do it, with her stream, and it has been amazing. I mean, she's gonna she's doing a s or did a stream, I think, with how to do animated stuff. I mean, and this is her job, and she's, putting this out there for free, so, I mean, honestly, this is a great resource if you're thinking about going into streaming or just wanna do some stuff, with photos maybe even. I don't look, I don't know how to use computers. I'm sure you can use overlays for all sorts of cool things, memes or what have you, but she shows you how to do it, and, that is an awesome resource, and I can't thank her enough for, sharing her expertise to all of us. And Sal has hyped me so much, so please help them get to their numbers so
oh,
they can
thank
get
you.
monetized too. And, I will be putting out a community note, but I am going to take tonight off. I thought I could kind of push
No,
through,
go
but,
for it.
um, I am going to take the night off. And yes, save the peens. I will see you all in the morning for more newsy news, and then I will be on with Nicholas, and we will be, taking care of the a-hole Adelsons.
Yeah,
Adelson?
opening statement is tomorrow.
Yes, I will see you all in the morning. Have a wonderful
Bye.
rest of the evening. Bye, guys. Let me get the end stream going. Bye, guys.